If you clicked this, you're probably feeling stressed, tired, but wired. That chronic state is often driven by cortisol, the body's main stress hormone. Today, I'll explain what cortisol does and give 5 science-backed dietary strategies plus practical tips you can use immediately to help lower it naturally. Quick context: cortisol is normal and helpful during short bursts of stress, but when it stays high for weeks or months, it disrupts sleep, causes stubborn belly fat, puffy skin, low energy, mood swings, and raises risk for metabolic problems. Diet won't fix everything, but it's a powerful tool that works with sleep, movement, and mindset. Tip 1: balance meals to stabilize blood sugar. Why? Big blood sugar spikes trigger cortisol surges. How to do it: make every meal a combo of complex carbs plus protein plus fiber plus healthy fat. Example plate: 1/2 vegetables plus 1/4 whole grains or millets plus 1/4 protein plus a small serving of nuts or avocado. Swap: replace white bread/maida and sugary cereals with oats, millet porridge, or single polish rice. Timing and portion: eat every 3 to 4 hours if you crash or feel overly hungry 1 to 2 hours after meals. Stop eating when you're about 80% full. Overeating itself raises cortisol. Hydrate: sometimes thirst masquerades as hunger. Tip 2: boost GABA-supporting foods to calm the nervous system. Why? GABA is a brain chemical that helps turn the stress response off. Foods that help: fermented foods, germinated/sprouted brown rice, spinach, and bananas. Practical: add a spoonful of plain yogurt or a small bowl of kefir to breakfast. Include a side of fermented pickle or miso soup with lunch, and throw spinach into smoothies or omelets. For sprouted rice, rinse well and use occasionally. Tip 3: include omega-3 fats to reduce inflammation. Why? Chronic inflammation keeps cortisol elevated. EPA and DHA are most effective. Food sources: fatty fish, salmon, mackerel, sardines, tuna. Plant elé sources: flaxseed, chia, walnuts. Supplements: if you're vegetarian or don't eat fish, choose an algae-based EPA/DHA supplement or a high-quality fish oil. Typical effective daily doses used in studies are in the range of 500 to 1,000 milligrams combined EPA plus DHA, but follow label guidance or a clinician's advice. Practical swaps: add 2 small fish meals per week or a daily tablespoon of ground flaxseed plus a supplement if needed. Tip 4: use pure cocoa and dark chocolate smartly. Why? Cocoa is rich in polyphenol and magnesium, both associated with lower cortisol and better mood. How to use: choose unsweetened cocoa powder or dark chocolate 70% cocoa or higher. Keep portions small: a teaspoon of cocoa in warm milk or 1 small square of dark chocolate. Avoid sugary milk chocolates. Excess sugar can counteract the benefit. Tip 5: avoid chronic extreme calorie restriction. Why? Sustained, severe calorie cuts or constant crash diets signal danger to the body and raise cortisol. What to do instead? Practice mindful, sustainable eating, reduce processed foods, maintain a modest calorie deficit if weight loss is the goal, and prioritize protein and micronutrient-dense foods. If you try intermittent fasting, monitor sleep, mood, and energy. Prolonged, aggressive fasting can increase cortisol for some people. Practical additions that help cortisol control: watch caffeine timing, keep caffeine earlier in the day. Late caffeine boosts cortisol and disrupts sleep. Limit alcohol near bedtime. It fragments sleep and can raise next-day cortisol. Stay hydrated and include small salt/electrolyte. If you sweat a lot, dehydration stresses the body. Prioritize sleep. Aim for consistent bed and wake times. Poor sleep is one of the strongest drivers of high cortisol. Simple stress habits: 5 minutes of deep breathing, a short walk after lunch, or a cup of warm kefir/tea can blunt spikes. Quick recipe ideas: breakfast: overnight oats with plain yogurt, sliced banana, a tablespoon of ground flaxseed, and a few walnuts. Lunch: mix salad with grilled fish or chickpeas, quinoa/millet, avocado, and a miso-based dressing. Snack: small square of 70% dark chocolate plus handful of nuts, or a kefir smoothie with spinach and cocoa. Dinner: steamed vegetables, sprouted brown rice, dal or tofu, and a side of fermented chutney. Safety note: these tips are dietary and lifestyle suggestions. If you have chronic health conditions, are pregnant, breastfeeding, or taking medication, check with a healthcare professional before starting new supplements or making large dietary changes. Recap: balance meals to avoid blood sugar spikes. Eat GABA-promoting foods, fermented foods, sprouted rice, spinach, bananas. Get omega-3s from fish or algae/fish oil supplements. Enjoy unsweetened cocoa or dark chocolate 70% cocoa or higher. Don't chronically restrict calories, aim for sustainable, nutrient-dense eating. If you want the full, printable guide with meal plans, exact portion suggestions, shopping list, and supplemental options, comment cortisol below and I'll drop it in the comments. If this video helped, like and subscribe for more science-backed tips. Take care, see you next time.